Deliberation of environmental policy would profit from an end to banter about premature death. The phrase is used often from the administration of Barack Obama, whose Environmental Protection Agency employed it liberally in press releases heralding egregious regulation. Apparently, it survives the Trump administration's campaign to restore constitutional order there. Cost of EPA's pollution rules, up to 1,400 more deaths a year, says the headline atop an August 22nd article in the New York Times. The reporter found the number in EPA documents assessing the administration's proposed substitute for the stalled Clean Power Plan. A measure appearing in such assessments is premature deaths. What then are premature deaths? How are they counted? Government agencies and private health organizations estimate premature mortality for many reasons. EPA uses it as a risk factor to estimate the value of a statistical life in cost-benefit calculations. For that purpose, a death is premature if it is thought likely to occur before some baseline, often 75 years, about the average age of mortality in the United States. The metric thus represents a highly interpretive statistical construct essential to risk analysis but unhelpful by itself for evaluation of policy. Statistically, absent explanations seldom forthcoming from eager bureaucrats or reporters leaping to judgment, those purported deaths in the New York Times headline might represent the expirations of 1,474-year-olds an hour each before their birthdays. Would that be compelling for policymaking? In fact, against broader assessments of premature death, covering causes such as drug abuse and infant mortality, 1,400 per year in the whole United States population is a very low rate. The naturally sympathetic, of course, will ask, well, what about those 1,400 victims and their grieving relatives and friends? But that's the point. Factors in the analysis of a single risk among the myriad risks confronting humanity are not identifiable people dying of specific policy change. A ready antidote exists for premature death, at least of the type flaunted without definition or context to influence thinking about policy: unshakable skepticism. I'm Bob Tippie, editor of Oil and Gas Journal, and that's the editor's perspective, which appeared first in text at www.ogj.com on August 24, 2018.